This meeting is being recorded.
So hello everyone and welcome to this webinar from your Rheumatology Clinical Interest Group. We're really delighted to be able to further profile the BSR Future Leaders Programme, and we've got a fabulous range of guests with us today. If you're joining us live, please do chip in with any questions. If you're watching this on catch-up, please do email us and we can pass on any queries. I must get the most important thing in first, which is the deadline for applications is the 30th of this month. So we've got about 3 weeks or so to get your applications in. We're delighted that the BSR are supporting this, and particularly that it's been highlighted as a Future Leaders Programme for the AHP workforce for registrars or early consultant rheumatologists and for nurses, but AHPs do feature quite heavily in their information on the course. And as a physiotherapy group, we have a number of physiotherapists joining us today who've been on the programme. But I'm going to go away from our usual. I'm going to speak to somebody who isn't a physiotherapist, as far as I know, as our first guest today. So we're very honoured to be joined by Guy Lubitz, who is talking about his course and his programme, I guess. And Guy, would you like your slides at this stage?
Yeah, sure. Thank you, Will, and everyone. I'm a professor of leadership and psychology at Ashridge Business School, and I've been involved in designing and running this program now for several years. We're very proud and delighted to work with BSR, and it's an opportunity tonight just to share with you a few details about the program. The main thing is actually hearing from the participants and our alumni. But I just want to say a few things just to introduce Ashridge for those of you who may not be familiar with us. So on the screen, thank you, Will. That's, if we can go, thank you so much. Yeah, you can see the Ashridge House, which is beautiful. We are very privileged to have this as a learning environment, and it actually shows the level of commitment that BSR is putting into this program. Ashridge House has a big history, a long history, which I will not go into, but we are, for the last 60 years, have been developing leaders from all over the world and the UK in a range of sectors to reach their potential and do good in the world. And if we go to the next slide, Ashridge also has a history in healthcare. And for those of you that can see, this is Charing Cross Hospital. That was based at Ashridge House during World War II. So our connections and history is also steeped with the healthcare service. And for the last 15 years, and we can see that on the next slide, we've been working with a range of clients. We're very proud of the clients that we have at Ashridge. These are international companies that come to Ashridge regularly to run executive education. Those are, we have amongst others, companies like Novo Nordisk, Ferrari, as well as public sector organizations like the civil service, and we've been involved in healthcare in the last 15 years, working with the NIHR, with the Care Quality Commission, CQC, with Versus Arthritis, Diabetes UK, and a range of hospitals across the UK. So long history now and expertise in working with clinicians, with managers, and deep commitment to the NHS and to the work that you're all doing. So this is a little bit about us, and thank you, Will. In the next slide, I just very briefly want to talk about the program. For those of you that are successful, and it is a competitive process, and so I'm glad Will mentioned the application process that ends at the end of this month, and we want to see as many applications as possible from allied health professionals and beyond. We want to hear from you, see you, and meet you, and hopefully, of course, see you at the program. Just to say, the program has several residential workshops where you are going to stay at Ashridge in the beautiful building and surroundings of Ashridge. There are 3 or 4 residentials, and also some work in between. Our alumni will talk more about what's exactly is required, but there is some time commitment involved. And also from a philosophical point of view, we will cover 4 key areas, which we believe are very important for allied health professionals working in a tough, changing healthcare environment to master. The 4 areas are the contextual domain, technical domain, relational domain, and personal domain. So 4 areas. And we will, throughout the course and the program, we touch on those 4 domains and really delve into each area to help participants improve their confidence, their skill set, the toolkit, and their ability to be more effective as leaders in a healthcare environment. So if I just say a little bit about the contextual domain, during the program, you will be able to hear from guest speakers about the changing context around us. We're bringing people that national leaders in rheumatology, but also beyond, to talk about what is changing nationally and helping you to think what may be the implications for you locally. The group itself is a multidisciplinary group, we already know, be it different professions, across rheumatology, and that's also an opportunity to share the context, share what are the issues that people are facing and grappling with. And we pay a lot of emphasis on how context is changing and what does that mean for me for me locally as a change leader in my own environment. The second domain, the technical domain, we open up this area around improvement, some of the quality improvement methods like Six Sigma, theory of constraints, start helping you again extend your toolkit to understand what may be the improvement methodologies that you need to apply in your own environment to make services better for patients. And finally, we have learned over the last 15 years that for you to be an effective leader, you need to learn a lot about how you relate to others, your relational domain, your ability to influence others without positional power, coach, get engagement and support in a way that is facilitative rather than directive. So we will do a lot of work with you and the colleagues when you come on the program to understand how can you relate better to others. We believe this is very, very important in today's environment in terms of creating and making change stick for longer times. And also, alongside the relational domain, we put emphasis on the personal domain, which is understanding a little bit about yourselves, your strengths, your weaknesses. We believe that leaders have impact on many people and how they show up to meetings, how they interact, how they understand how to leverage their strengths and how to minimize their weaknesses is absolutely critical. So a lot of fun, a lot of work around those 4 areas, just to give you a bit of flavor about the program. And with that, I'll hand over, I think it's now for Kay, is that right?
Yeah, thanks very much, Guy. A great description, and we're very honoured that you've given your time to enlist us and encourage us. We're moving on with the enlisting and encouraging, and Kay very kindly responded to my message to say we'd love to hear from somebody else who's been through this programme, and I think Kay's a great example of that. I've not given you too much of a script, have I, Kay? You've got a bit of a free rein here to tell us how you came into the programme and what you've done with it, I guess. So I'll let you introduce yourself, if that's okay.
Yeah, thanks, Will. That's great. Thank you so much, and Guy, for the opportunity, really, just to kind of share my experiences of when I did the Ashridge programme with Versus Arthritis. So I'm Kay Stevenson. I'm a consultant physiotherapist and honorary professor at Kew University, and I'm also currently doing a secondment with NHS England and Improvement. So when Will said, can you share your experience of Ashridge? Well, I started to write a list and just went on and on and on and on and on and on. My experience has been overwhelmingly and without a shadow of doubt hugely positive, for some of the reasons I'm going to share with you. So I would just say, please do take the opportunity to apply. It is a phenomenal program, and you get to learn so much about yourself, I think, as a leader, as you go through those four components that Guy was talking to you about. So just a couple of reflections from me, really. So I think that the time away that you have with both Guy and other like-minded people really can't be reproduced. It is something really special to have the time to reflect, to learn new skills with people who are like you, who are leaders, who want to make improvements, who generally want to make a genuine transformational change for patients. Of course, you will hear from and have direct contact with some subject expertise. I mean, Guy is there with you all the time, but external speakers will come in and share their expertise with you. And these subject experts are, you know, internationally renowned for their knowledge and their research around leadership. So, you know, where else would you get this? It is just fantastic. What I also found was really important and an important learning for me, and many of us found this, I think, that it was a safe space, a real psychological safe space to kind of play out some of our challenges, some of our kind of concerns. And I kind of, in one of the sessions for us, we had some actors to come and represent some difficult conversations that we might be having with other people in our sphere. And I found that really very helpful but challenging, because you start to kind of appreciate the impact that you may or may not realize you have on other people. So in this particular role play, you know, I had to sort of face some quite challenging feedback on my style. So what I would say is hugely positive, but come with that open mind of, I'm going to hear some things said in a really constructive manner that I need to kind of hear to improve my leadership style and my impact on others. So I found that hugely powerful, important, and I'm so glad we had the opportunity to kind of hear those messages, because perhaps in our day-to-day busy working lives we don't. Lots of time for reflection, and whilst you come with a project, I kind of got to observe and reflect that the project was mainly me. You know, it was the work on me and how I show up as a leader and how I can be more impactful. And as Guy said, you know, maximize my strengths and reduce my weaknesses. I'd also put on my list here using each other as experts, because we're all, you know, phenomenally experienced in our own worlds and have had great experiences at transformational change and leadership, and we want to learn from each other, and we absolutely had the opportunity to do that. One of the other things I also thought that we had the opportunity to do was really to think about how we look after ourselves as leaders. Very often you're the person who's kind of thinking about bringing people together to kind of share and cultivate and craft ideas. And very often, you know, you're the person who's working, you know, very intensively and required to do that at the level you're working at. So how do we look after you as leaders to make sure that you don't burn out, or, you know, you're still there in the next 5-10 years driving that transformational change? So how do we look after each other and ourselves in these roles? One of the things that I reflected on, and it's a great piece of work that Guy led us on, and forms part of Guy's book, which you may or may not hear about. I'll go and get a copy so you can see it. But it always struck me that I always seem to rub up against the same sort of types of people. We did a great piece on learning about how we connect with people and connections, and how sometimes our personalities have positive sides, but then also have a shadow side. So kind of getting an understanding of how we might interact with people. And that was like a bit of oh, I get it now. I see why I always rub up against the same sort of people for the same sort of reason. So again, it just gave me additional skills to kind of then cope with that going forwards. There's tools and methods methodologies that you'll hear about and you'll have exposure to. And there's also, I don't know whether you're going to do another 360-degree appraisal type opportunity where you get to, guys nodding, yes. So again, you get to hear what people are thinking of you from your outside, from your sort of management structure, your team structure. And again, that's a great opportunity to kind of reflect on how people perceive you as well as how you perceive yourself, and where that gap is and how you might grow into potentially how other people are seeing you. And of course, there is the Guy magic and the Ashridge magic. It can't be put into words. It's just a thing. It's there. Once you're there, you'll know it, you'll feel it, and it really is something very, very special. So that's kind of my kind of reflections on the experience. But Will and Carol said, so what, Kate? So what have you done since? And I would say that the course has made the difference, or the program made the difference to me in terms of I absolutely will take that opportunity. So I absolutely will apply for that professorial position. I absolutely will apply for that secondment to NHS England. I absolutely will chair the Integrated Care System Musculoskeletal Transformation Board. So what it's done for me is kind of say, well, if not you, who? And give it your best shot, and take all those skills and lessons learned and try and craft that culture of leadership, and that culture of leadership that everybody needs to participate in, so that we can have this transformational change that we need. So I think that's would be my reflections. In terms of your application, I would just be really honest with yourself about where you are as a leader. What is it you need to take that next transformational step? So think about, what holds you back? Is it your confidence and imposter syndrome? What could this program, given what Guy's told you is on offer, how does that help you then have a much bigger impact for the patients that you see? And just be really, really honest with yourself about what is possible, what is doable. And I would just say, take every opportunity. Whatever you put in, the more you put in, the more you will get out. So when you get homework, which, it's fairly light touch, but you are required to do some work in the background. The more you do that, the more you put in, the more you will get out of the program. So I think, Will, I will leave it there, but I'm very, very happy if anybody wants a kind of conversation out of the webinar. I'm very happy for you to share my email if people want to kind of make contact outside of this to kind of get a sense of anything else I've chatted about. Very happy to be contacted.
Sorry, I just didn't come off mute quite in time. Thanks very much, Kay. Excellent summary and really inspiring, as have our previous two speakers at our previous webinar been. So I'm going to invite Dave and Dermot onto the stage with us, if I'm up to that. And I think I'll see if I can get Guy up as well. So there are options for any of our attendees, our colleagues here, to ask questions in the chat. I've got a few questions that have been sent in advance, and I think I'm going to add my own question that Kay was speaking, really, and it's the first part of the title of this program, which is the BSR Future Leaders. So, we've got 3 excellent leaders, or 4 excellent leaders, or 5 excellent leaders on the screen at the moment. How do you know when you're ready to do this? If you've never put your foot forwards on this kind of thing before, how do you know it's right for you? And how can we feel we're at the right level to throw ourselves at this? Because maybe rheumatology physio are quite a meek and supportive, gentle crowd, but not so good at stepping forwards. So I've got 3 people off mute, but I think, Dave, you were first off mute. I don't know if you want to talk into that.
I didn't unmute to answer first, actually, but I would say there was a massive spectrum in the versus arthritis cohort. There was a big spectrum of people of case standing, and Dermot standings and Ruth Sefton standing, all the way down to people like me who are fairly new to leadership positions. And I think the beauty of the program is that all of us acknowledge none of us are finished. We're all imperfect and never designed to be perfect beings. and perfect leaders. And I think you can learn at any stage of your career. And I think when it comes to future leaders, it's not necessarily that the position you are in your career and how far you've got left to go, but it's more really about the development and developing others and supporting each other to develop the rheumatology BSR group as a whole. And I think physio is key to that. It's absolutely essential that physio is part of that. And I'd say as far as nursing and the other professions as well, there's a debilitating imposter syndrome that can come as a result of being up there at the front, and the consultants will certainly be applying, and I think it's important to have our voice there.
Great, thank you. And I think that's one of your children joining in and supporting your point there, Dave. Thank you. And I should say this,
yeah.
You're leaving on a pickup mission fairly soon, so I'm glad we got your input early.
Do you want me to add to that? I would say that if you're a practitioner, and if you're continually having ideas about creating change, or you're continually thinking about how do I make improvements, and you're continually thinking about how do I kind of demonstrate an impact, and if you're also open to change, and if you're open to hear some reflections about yourself from others, but also kind of have those reflections about yourself, then you're at a point where you should be putting in an application. And I think I wouldn't put it any more stronger than that. If you are thinking of ideas, if you're thinking of quality improvement, if you're thinking of ideas all the time about, oh, this could be better if we did this, you know, at a service level or a system level, or, you know, and you've got that openness to kind of, you know, accept that sort of, you know, everything that Ashridge will offer you, then you are ready for an application, I would say.
Yeah, just to follow on from that, I think as David was saying, that they're not looking for the finished product, looking for people open-minded, with interest, but a key interest to change and to make change. I think one of the excellent things about Ashridge was that supportive nature. Yes, we had the sessions, and they were focused on you know, interpersonal skills or communication, whatever else. But an awful lot of the benefit was that time away. We rarely, as leaders or professionals, have a time where we can just sit down and talk stuff through, and what about this, what about that? And I think whatever level you're at, this is not about banding or grade or where you are in your career. This is an opportunity now as a junior member of staff. In 10 years' time, you could be that leader, and this will give you the foundation to make those changes and to understand maybe a bit more about the challenges that your leader of your team has. And maybe you could be that facilitator in that team. But so to get anything to work, we need all those different components, all those different players and actors, as Kay was saying, to make the change. So it's not just about that person in front, it's about the whole team.
I'd probably link into another point, which was about having the time to be able to apply and go to the programme, because there are concerns about time commitment and all those types of things. And in the NHS, we try and tread water a lot of the time without realising that some time away actually can make things much more efficient when you get back there. And I think the ideas that this generates and creates, and the energy that comes behind that, and the different ways of thinking and approaches to things, mean that when you come back, actually you work much more efficiently and much more aware, and have the bravery to open doors that maybe you wouldn't have before, certainly from my perspective, wouldn't have had before I did the programme.
And I suppose this has been hinted at. Thanks very much, guys. Excellent answers. And I love the way you follow each other without me having to prompt. So Guy, you've got a bit of a vision in your head of who's going to be on the programme. And from your previous experience, there's a mix of people and levels and specialisms. Do you have a kind of formula? I don't think you necessarily need to tell us the formula, and I don't know if you do, but what's your kind of vision of who you're going to have in that room on day one?
So we don't know, right? And the reason we're doing this is that we want to encourage participation, and I, following what everyone else has said, we really hope to hear from you. and just to put the application form and come and join the conversation. And it's for me around the fit of someone rather than how good or not good you are, whether that's a good program, is a fit for you, is this the right timing for you? Those are the kind of questions we're going to ask. We know it was going to be a multidisciplinary team, so be across the professions. And I like what Dave was saying earlier. We want to have allied health professionals, physios in the group. I have noticed that actually they're very, they're also they're very fit, the physios. So they've made me run every morning, which I don't. I mean, normally I see middle-aged corporate men. So having allied health professionals helps from that perspective. But of course, we want in the room the diversity of the system. So it's very important to have all the voices there involved. So yeah, looking forward, I would just say that there is ambition from a BSR perspective, that this group will be a pipeline for people that will go into more senior role and influence and shape things. We see in this today, there's a wonderful example of people that are doing that, and it's a pleasure to see. So we're looking for more folks that are now perhaps more in the shadow to step in and join that pipeline of talent that will help and shape things for the future.
Great. I like the idea of stepping out of the shadows, and it looks like quite a sunny beach you're on, so we'd all like to join you there, Guy, if that's possibly not part of Ashridge, but we'll see.
Will, can I also offer, if there's anybody who's absolutely can fulfill all the criteria we've been talking about and what Carol's put in the chat as well, but may have some reservations from a senior manager, I'm very happy, I'm sure the others would be as well, to have a conversation about the potential impact. Because if it's that, if you've got to go to your sort of middle manager and say, can I go on this course, can I have the time, sometimes for those people to actually hear the benefits, it's really, if that's going to help make the decision, then please, I'm very happy again to kind of have a chat with any sort of people who are kind of making the decisions with you around your how you're spending your time on your study leave, etc. I'm sure Dave and Dermot will be the same as well. I'm sure.
Yep. Yeah.
Thanks,
happy
Kate,
to share.
great offer. So I've got a question that was pre-submitted. It's actually a question in two parts. So this is perhaps speaks into that ability for us to be able to carve out time that you've all talked about a little bit. So the first one I'll ask you about is, what sort of tasks or homework do you work on between sessions? And then the lead on from that is there an exam or final presentation towards the end of the course? So I think the questions are probably pushing at how much is this going to drag away further time from an already busy person?
Well, there's spellings every Sunday that we all have to do. But in terms of homework, it's a very light touch. There's a lot of personal development that happens, and trying some of the things that you learn out in each session. And that they actually tend to come to fruition. Then the learning that you share the next time you go or meet up, and how it went and how things are going and things are developing. In terms of ultimate project, you are the project as an individual, not that you're designed to create something at the end of this that will come to fruition. That tends to happen organically as a result of those things, but it's not, a guy may correct me on this, but I'm pretty sure he won't, it's not one of the undue pressures expecting you to come up with a mammoth project that's going to shape the national stage of rheumatology at the end of it. But what will tend to happen is it will organically happen, that you'll get ideas that you can start putting into place, which will come to to the fore, really. And I think Kay's certainly got projects that have come to fruition, Dermot, myself, and we'll all see the benefit of those things, and then we share amongst each other.
I do think it's.
Yes.
I think the way to see this is it's not really an academic procedure. I think it's the first time I've done anything that was about personal development, professional development, rather than trying to attain an exam. You know, and we've all done those, you know, whether they be the injection or MACP, or we've all been there. But this is not about that, because it is, you know, about your personal development. It is about where you're at, and for the team of experts there, led by Guy, to bring you along that journey and to make you a better leader and a better understanding of yourself and the situation that you're in, and as a team to be able to work stuff out together. I think as a group, we did some great stuff. Because everybody had a slightly different view, had some slightly different skills. It was, you know, it's been really, really useful.
Sure, and if I may add, just in terms of time commitment for those that are considering that, over 1 year you'll have 4 residentials. So 4 residentials which you must attend, and 4 action learning groups that happen in between to help you embed the learning. So that's, if you like, the mandatory aspect of that, which is all fun and everyone is happy to do. And but the dates are in the application form, so you can see that. I would say that BSR as an organization wants to form relationship with the candidates, with the participants. So you will probably be asked during the program, but also maybe after the program, to be involved in maybe some media activity. If there's some policy changes, you may be kind of be volunteered to speak and serve as a sounding board. This group that you're meeting tonight has been doing a lot of those things. And that's been, I think, one of the advantages for BSR, to have real buddies that are willing to help and support, that are involved in operational strategic issues all the time. So I hope it helps, just to give clarity on that.
Great,
So I'll come in last. See, I've learned something. This is Ashridge. Kay Stevenson is quiet for a bit, doesn't speak first. So I've learned loads. So I think I just echo what everybody said, really, is that the more you put in, the more you get out. So, you know, any reading in advance or preparation in advance is always, I think, like you would do for any course or any program, you know, whatever you can put in beforehand. And if you can link you've got a project, if you can link that to what is already happening at work, or you've already got ideas around, then those kind of align quite beautifully, I think, with, you can, as Dave says, you can try things out in that project that you were already thinking about anyway. So, you know, if you can align those really closely, then I think, you know, that you sort of maximize the benefit, and then that kind of builds in your application. You know, well, this is the project I'm working on. That's very obvious to the kind of your senior team who are going to perhaps be giving you the study leave. But it also gives you the opportunity to try out the things that you're hearing about within the context of the project. So yeah, but there's no exam. I think it's that really is that reflection on your own sort of personal leadership style, isn't it, as you go through that 12 months.
Great. Well, if this evening was an exam for our 3 graduates, I think you've all passed with flying colours. Thanks very much, Dermot, Kay and David, for your time, and particularly thanks, Guy, for joining us. And it shows how engaged you are with this project, that you've given up a chunk of your evening for our small group, but with a hope it will lead to big things from that.
Thanks, Will, and good luck, everyone.
Thanks, Amen. Glad to help. And as we said, if anybody wants to get in touch with any of us, we'll be glad to help. Or get in touch with Kay.
Yeah.
You won't be able to get a word in edgeways.
Yeah, delegation.
And thanks very much to Carol for putting all of that information in the chat for everyone to access, which you can also get at the BSR website. If you search BSR Future Leaders on any search engine, you will find a BSR web page for that, with all the details, application deadline and so on. And the second hit will be the video we did last month, and hopefully this video will be the 3rd hit. Now, just as we screech towards the end of our allocated time, Sophie Taylor's come in with a question. Hi, Sophie. Yes, you're welcome to ask a question.
Hi, Sophie.
Sorry, I hope I haven't held you back. I thought you were just going to open the floor to us.
No, you're good.
Quick question. Thank you so much. And I'm so glad that I was able to join you this evening. Really, really interesting. I just wanted to ask a question to the participants, to Kay and Dermot and Dave. Very briefly, what changes have you seen in yourself and your service as a result? Are you able to give us a feeling or a flavour of that, please?
If anybody doesn't mind, because I'll go first and quickly, and then I'll dash off. I think, Sophie, it's great to see you, well, or hear from you. I think there's two bits there. I think as a leader, I'm much more approachable, open, and encouraging and nurturing of others in the team. And I think that comes as and confident to open the door to the CCG or whoever it is now, to go and ask for help and support for projects. And I think with us in particular, it's meant that we've got the lowest number of surgical waiters in Greater Manchester and the highest surgery rate in spite of COVID times. So it's helped us get certain things done that wouldn't have happened otherwise. And I think it's having that confidence to go and get out there and help and support, and it goes two ways. Is we've helped the GPs in the local practices by doing things for them, and in the sense of they come back and help us when we need it. So there are some really lovely projects that have gone on, and the decision support tools on versus arthritis as well was my project with Benjamin Ellis that wouldn't have come all the way through to fruition if it hadn't been for the leadership program. For definite, that definitely wouldn't have happened.
Brilliant, thank you.
Right, I am going to go, so I shall leave you all, and I shall see you soon. But by all means, get in touch if anybody needs any help.
Thank you very much.
So perhaps I'll add to today's response, if that's okay. So I think what the programme basically is done for me is that it's that additional confidence, I think, is that sort of ability to step forwards rather than sort of be slightly behind somebody else who might be taking the lead. So since the programme, I've started to lead a large integration project. So again, about trying to improve what patients experience in our services, and also what staff, their kind of aspirations, if you like, so that we've got a service that is much more aspirational and allows people that sense to see what it means to be an APP or a consultant physio. So, and I don't think before this I would have stepped forward to volunteer to chair an ICS, to integrated care musculoskeletal transformation. I'd be like, me? You're kidding? No. Whereas now I'm thinking, well, absolutely. I'm going to be open and bring people to the table. I haven't got all the answers, but if we collect enough people around the table, I bet we can solve it better together. So I think probably I'm learning to be, a lot more of an enabler, a facilitator, opening doors for other people, and hopefully doing a lot more of the co-creating change. So, not thinking, I've got to think the answer. What is the answer to this problem? 9 times out of 10, it's going to be much better if you do that together with a lot more people around the table. So I think that's probably the difference that the programme has made to me individually, and in respect what that difference to kind of clinical services in Stoke-on-Trent.
Yeah, I think I have to back up what Kay said there. Probably the biggest thing it's done is dampen down my imposter syndrome. That actually we now realise that when you get into that room, I think we've all been there in meetings and going, how the hell did I get in here? How did I get past this room? And then you ask everybody else, and they're all thinking exactly the same. And actually to have that insight, to know that. And I remember we did a session, I think it was with the actor, and the idea that, good is good enough. Excellent is great, but good is good enough. And I think as professionals, we tend to let the perfect bully the good enough. And as far as myself, for projects I've been involved in, sort of national stuff, the Code Equina pathway, the national pathway work, we've done some excellent stuff there. I've made some phone calls to consultants and to other leaders that I wouldn't have done in the past because I wouldn't have had the confidence to. But now I'm quite happy to sort of step up at times and go, actually this person needs to be involved. I don't mind making the call. And I think that's the confidence, that inner strength to say, to make this work well, we need more people involved. We need those leaders there. We need those experts there. And actually, people are willing to help. And I think I've learned that. And if you can get the right people in that room, it's not about us having the ideas and leading from the front. It's us facilitating, creating that collective co-creation environment to get the best things for our patients and for our services.
Oh, thank you all so much for those answers and being so frank and honest. I really do appreciate that. Thank you.
Thanks very much, Sophie. Always nice to hear from you. I'm just going to loiter a second in case there's any other questions whilst we have the expertise in front of us. Okay, you're on mute. I don't know if you're talking to us or just...
I'm just thinking, how Dermot do we disguise another application to go again?
That's a decent endorsement.
Absolutely, do it again like a shot. Absolutely.
Will, just to say from my side, thank you for hosting us this evening. Real pleasure. Really great to hear the group speak. And I have to say they led really well tonight. There were leaders in the classroom when we met, but they're also leading at in the evenings where we had other activities. So it's been a lot of fun, and so it just brings back lots of good memories. So thank you for the opportunity, and thank you for taking the time. Great to be here.
Great. So I will wrap up there and press the stop record button. Thanks so much for taking your time to log on and listen or watch again. And we would love it if there was, I think there's 212 members in our group. We'd love it if all 212 applied, and beyond physio, we'd love to see MDT involvement across rheumatology. And there will be major changes for rheumatology from this program, which we're very excited to see. So I just need to learn how to press the stop recording button, and we will see you for our next webinar about the FCP program and how you can integrate that with your local rheumatology service. And that will either be July or possibly after the summer, catching up with you in September. But bye for now.